Join us as we explore a variety of school safety topics, ranging from digital citizenship to STEM and science lab safety, from bullying among students to school-wide trauma responses. Welcome to Safer Ed. Today we will examine another aspect of safer schools, and that is mental health awareness. To add some dimension to this discussion, we have two fabulous thought leaders joining us today who can help us better understand how to best serve our students, parents, teachers, and the community when it comes to youth mental health. Joining me today is Ann Brown, President and CEO of Cook Center for Human Connection, and Tobin Novasio, Superintendent of Lockwood Schools in Lockwood, Montana. Ann has been the president and CEO of the Cook Center for Human Connection since its inception. Her decades of experience as a public school teacher and an ed tech executive have given her a unique ability to bring aspects of education, corporate, and nonprofit leadership together to solve the real-world crisis of suicide. As an ed tech executive, Ann led marketing implementation, sales, curriculum development, government relations, business development, and product development, all of which brings a wealth of talent and abilities to her role. However, more important than the skills Ann offers, it is her early life that gives her the heart for this work. With a father who suffered from alcoholism and bipolar disorder, and a grandfather who died by suicide, Ann understands firsthand how mental illness and suicide not only affects the person suffering, but all of those around them. Family, friends, coworkers, and acquaintances all are impacted greatly when one individual is struggling. In her role with the Cook Center for Human Connection, Ann oversees the work of the foundation, develops strategy, and leads collaborative efforts between stakeholders in this work. Before joining Cook Center, Ann worked for several organizations, including Salt Lake City School District, Pearson, and Waterford.org. Ann lives in Park City, Utah with her husband, enjoys skiing, e-biking, reading, and spending time with her adult daughter and adult son and their two large dogs. Welcome to Safer Ed, Ann.
Thank you. Wow. We'll send you a shorter bio next time.
Oh, well, we're happy you're here. Also joining us, we have Mr. Tobin Novasio, Superintendent of Lockwood Schools in Lockwood, Montana. Mr. Novasio is the Montana Rural Education Association Vice President and sits on the AASA Executive Committee. He is the former Montana Association of School Superintendents President. He has been honored by his peers as the Montana Superintendent of the Year in 2016, congratulations, and the School Administrators of Montana 2020 G.V. Erickson Award recipient. More congratulations. The most honored award a school administrator in Montana can receive. Mr. Novasio represents Montana's K-12 schools on the Montana Early Childhood Advisory Council. Welcome to Safer Ed, Tobin.
Thank you for having me.
Great. Okay, so the topic of today is mental health awareness. What I'd like to start off is simply talking about what that looks like in today's traditional school environment. But to do that, something that I'd like to start with is when we say youth mental health, what precisely are we talking about? And it's a very generic question, but I think it's important to define youth mental health before we get into this conversation.
Yeah, I guess I can take the lead on that. Mental health is a wide range of things. And, we'll talk a lot today about suicide. And honestly, suicide is obviously one of the worst possible outcomes we can have. But really, a lot of times when we talk about suicide, it's more of a measuring stick for all the other mental health issues that are out there. It's just something that's we have hard data on that number. And so, one thing we as a district do is we actually have called out social emotional learning and needs as part of our overall plan for a school district. And within that, we have things like building capacity. So kids understanding how to respond when things don't go your way, self-regulation. Prior to getting into administration, I was a health teacher. So Maslow's hierarchy of needs has always been a huge focus for me. And we have that written right into our guiding documents as a school district. And so, we do things beyond just the mental health side of things, but making sure that the kids are fed and that they have clothing and that they have we have to hit those safety levels if we're ever going to get to that higher level of learning.
Right. And I'm sure you have plenty to add too.
I would just respond, building on what Tobin just discussed is mental health is health. I mean, at the end of the day, it's as important as physical health. And just like you can have a cold in your physical health, you can have a difficult day in your mental health. And we need to be respectful of that, regardless of whether it's a mental health thing or a physical health thing. I've had parents say to me, you know, if my child breaks their leg playing soccer, you know, all the kids are around, signing their cast and encouraging them to go on. And if my child is having, you know, a mental stress or mental disorder, it's like people scatter. Mm-hmm. And so we need to think of mental health as just part of our entire health structure. And we need to care for it in the same way. Sometimes we might have difficult things like, you know, like a broken leg or like, you know, a mental health break. Sometimes we might have small things like, you know, sniffles and a cold. We might just have a day where we need to stay home and rest and focus on ourselves. And we need to make that okay, regardless, and not have mental health have a stigma around it. And I think our youth, you know, the good news about our youth is they are so much more comfortable talking about their mental health needs than we ever were. But, you know, we also need to just let everyone know that mental health is just health and it's part of your health structure.
I love that. It's actually funny you bring it up that way. My husband and I were having the same conversation literally earlier today. We have one of our kids is sick, like physically ill, and our other kid struggles with anxiety, and reminding ourselves to reframe our lives as a family as we have two sick children instead of one, because we have to support both of them as they heal to get better. And it just looks different when it's mental health versus when it's physical health, but it doesn't make it any less important. I want to talk a little bit more about what those resources and supports look like, specifically in schools. I know every school, every state, every school district, every school building is going to look differently. Tobin, you might want to take the lead here in terms of the supports and what they look like at your schools. But that's kind of where I want to go from here is, what do resources and supports for mental health actually look like? What do we see? What do we hear? What don't we see? What don't we hear? But it's actually happening behind the doors, all of that.
Yeah, I could probably spend the whole rest of the time that we have allocated today just talking about the different resources we have on our campus. And kind of following that same theme that Ann talked about with mental health as health, it's also part of our education. So, you know, we are a multi-tiered system of support. Academically, we're also a multi-tiered system of support behaviorally, and we try to have a multi-tiered system of support for mental health needs. Some kids, the vast majority of kids, are going to need just the very basic, you know, a little bit of introduction to some things. So like in our elementary school, we use the PACS Good Behavior game. That came out of the Montana mortality study that was done on youth suicide. And that was one of the things that they'd identified as something that could be done at a very young age to teach kids self-regulation that had an impact on suicide rates as they went through. So all of our students will get that in K through 2. But then as they go up through the grades, or if counselors and principals find that they have additional needs, they may be referred to things like Y-Try or Second Step, or those type of programs we have in place. We also, through our partnership with the Cook Center, you know, we offer parent guidance, and we also have in the middle school and high school, we have Hope Squads, which we'll talk about, I'm sure, quite a bit more as we go through. But we have that wide range, knowing that a lot of the kids are just going to need this very basic support, and like, you know, you might have a bad day. But then we know we are going to have other kids that are going to have a little bit more severe issues, maybe some of those anxiety things that we've talked about. And then we know we're going to have kids that are going to need some intensive interventions. And so, you know, we're in a rural area as well, too. Actually, we're closest to the biggest city in Montana, but we're still pretty rural as far as the big picture goes. And so the challenge of getting to providers is a huge thing. And so one of the things that we also do is we contract or partner with local providers and give them offices in our campus where they can come in and have meetings with kids. It's not saying we endorse them or anything like that, but it's saving the parents having to take time off from work to get the kid to the appointment, those type of things. And just we help take away any of those barriers for keeping kids and families from getting the help that they can as much as we can.
And I just really want to say, Tobin and the work that his school is doing and his staff is doing is really pioneering work. Tobin has been engaged in this mental health journey and SEL for years. And when we started in 2020, he was really one of the first superintendents that we started meeting with that said, yes, and, we like how he just described this multi-tiered system of support is really beautiful, to know that a child at any level and a family at any level can find that support. And as we were developing the Cook Center resources, we really looked towards the family. The issue going on in schools right now is there are a lot of supports for children, but there aren't many supports for families. And why that's important is we're also in this country, we're about 50,000 mental health workers short in the country. So school districts, they have the money to hire, psychologists and counselors and social workers in ways that they've never had those financial resources before. Yet these are very difficult positions to find and fill. So I've talked to schools that have been waiting, 9 months to a year and a half to be able to hire some of these positions because they're so difficult. And at the same time, I've talked to families who are needing the help of a therapist or a psychologist or a psychiatrist for their child. And when they start calling outside of the school system, they are 3 to 6 months out from being able to get an appointment. So there's a real disconnect there in the middle. And part of this is my background is education, and part of it is I'm the mother of a child with autism and some severe anxiety and some learning issues and some of those things. And so I've had those experiences. I've had those experiences of trying to call and trying to get that help, and it's very difficult. And I've also had the experience of expecting my school to handle the need, but finding out that my son had hit a point where he was a little bit beyond what the school's help could be. So the reality is this is some of our early research, is that 80% of families rely on schools first for their child's mental health. That's my experience. When they step out and they start looking into the medical world, they're months and months away from service. And so at the Cook Center, we really thought, how do we help that? And when you were reading my bio, you can see that I really understand the family strife that goes on around mental health. The first time my father went into a mental institution was 3 years before I was born. And so when I say I was born into a mental health needy family, I really was, and it's continued through my own children and family. And so anyway, so I just thought the family is the place where you can really have the biggest impact. And when we started talking with Tobin, he was so encouraging of that. So what we've created is something that increases access. So any family anywhere can access our services privately on demand and in their home. And then when it comes to care, we don't get them to therapists, but we can get them to a coach. We can get a family to a coach within 24 to 48 hours. And we're not serving the child, because there are a lot of places where the child can get served. But what we feel like, if we can educate the parent, they can be that first line of support for the child. And I think of it like, if you go back 150 years, people didn't know that hand washing was an important thing to do. They didn't know just the basic skill of hand washing and how important that was. And people were dying from infection because hand washing wasn't going on, right? And so we were able to, publicly make that a basic part of hygiene. And there are some basic things, we're in this mental health crisis. Lots of kids have anxiety. Lots of kids have depression. There are just some basic things that families can understand about how to support their child with anxiety or depression that can help the child have a better day, life experience, but also can help the families be stronger and feel more equipped to not get to that frustration level with the children that they're working with. And so our goal is to really educate and work with the families through our parentguidance.org services and supports. And that's the work that we do with Tobin.
And I'll piggyback on that a little bit. I will say that, and Anne's heard me say this a couple of times at presentations, the biggest epiphany I took out of the pandemic as an educator was I was really blown away with how many families relied solely on the school for mental health support for their children. And so when schools were shut down, we had people reaching out to us. They had no idea what to do or where to go without our school counselors. And I don't think people understand how many different things school counselors do on top of that. I mean, the mental health is a small portion of that. And so when I first connected with the Cook Center and the parent guidance, one of the things that really appealed to me, and one thing that I tell young superintendents, people that are getting into this business, my job as a superintendent really completely boils down to resource allocation, resource management. How can we maximize education for our kids with the available budget, the available people, and the available time? And so this really fits into that, because in our 4 schools, I might have 3 different principals working with kids from the same family. So we're recreating those efforts in each different building when it could be more efficient to help the parents develop some more of their parenting skills, whether it's setting the proper boundaries or, all the myriad of things that parents could do to better support the schools. And so just trying to divert a little bit of those resources to helping that mom or that dad that's looking for help that benefits all 3 kids, rather than having each of those principals recreating and trying to, the high school principal is working on trying to keep a kid from dropping out, and the elementary principal is working on attendance, and the middle school is maybe working on anger management, when we could work with the parent to try and help them address all those areas.
And it's that parent-school connection too, which ultimately is strengthening your communities.
Yes.
More ways than one. I also love what you mentioned about, the multi-tiered system. It's honestly, if you boil it down, it's no different than having a multi-tiered system approach to literacy.
Mm-hmm.
Yes.
Right? It's just taking what we know as best practice as educators and tying it to, honestly, when you think about it from the Maslow's hierarchy of needs, what it all boils down to and what's really important. I love that.
And it's an easy concept to have those conversations with educators, because they understand that. They understand it when it comes to, like you said, literacy. They understand it when it comes to behavior, and just taking that same model and applying it to mental health.
Makes so much sense.
And what we understand and we realize is that, kids under extreme stress, or anyone for that matter, under extreme stress, you can't take in information and you can't produce information. And so they're not able to reach their potential unless we're helping with their mental health, unless we're helping them have those calming experiences.
Right. Yeah. A student who is struggling with their mental health, that same student, if they weren't struggling, would learn more, be a stronger student.
We do professional development for teachers as well. And one of the activities we do is we simulate stress, and it's actually very fun. But there's a real point to it. So when we're simulating stress, we're basically taking a tennis ball, you're in a circle, and we're throwing it at people, and they have to catch it. And if you catch it, you have to produce a piece of information that your mother's first name, right? Something that is embedded in you that you know. Well, what they find is it's really hard to remember your mother's first name when a ball is being thrown at you, right? And then you immediately have to throw it away and to the next person. And then at the end, you say to people, can you remember anybody's mother's first name? And they might have 1 or 2 people, 1 or 2 people might remember 1 or 2 names. And then you say, can anybody remember everyone's name? and zero, like no one got all of the information, even though it was simple. The activity was well understood. You knew a ball was going to come to you and you knew what you were supposed to say. But when it was all said and done, your mind just cannot, when you're under stress, your mind can't take in the information and it can't produce it back. And it's really a aha moment for people when they have that experience.
So true. So true. I actually want to talk about teachers a little bit at this point. The reason I think will make sense quite quick. So I want to talk about teachers in terms of teacher burnout being real. When we think about it, when you're on a plane and they say, flight attendants tell you, put your oxygen mask on before you put the oxygen mask on your child. And this actually works for not just our teachers, but for our families and our parents and our parent or guardians who are supporting these children at home. How do we support our adults so that they're in the right frame of mind to support the children? And I'm talking about every child, from the one that's in crisis mode to the child who just has a bad day once a month. How do we best support them?
Yeah, and I'll be honest with you, this is a nut that I've always found kind of tough to crack, because just like we talked about, sometimes kids don't want us to know what's going on, neither do staff. And I hate the idea of, I'm going to come from my superintendent's office and tell you what you need so that you can feel more supported. So really trying to open up that level of communication back and forth two ways so that staff can communicate what they need. We do a lot in my district for teacher appreciation. Well, teacher appreciation rolls around in May. They can kind of see the finish line. So this year we actually took some of the resources that we had and we put them towards the start of February, when it's kind of that time of year where things are just dragging. The Christmas break's done, summer vacation's a long way away. And just to try and get some feedback on that. And I think it's really important to have open communication. And the thing that I think has been a positive benefit of all the efforts we've made with student mental health is we've started those conversations. And it's okay to have conversations about anxiety and stress and those type of things in our district. And I think that opens that up more for staff to feel that way and have those conversations. And once they're open with us as an admin team, then we can respond to that and say, hey, go ahead and take Friday off. Why don't you take that day off? Mental health day, take a break. We'll cover for you whatever we need to do. Or, just let us know what we can do to be supportive. And I think it's just really trying to remove that stigma as much as we possibly can. I do also want to give credit to a friend of ours, and as well to former AASA president, Paul Imhoff. And I'm on that board, and Paul's theme for his year, and he was the year following, the COVID, was live well, lead well, and really reminding us to take care of ourselves so that we're not at that extreme where we don't have the patience with staff or with parents or with students and those type of things. And just kind of trying to remind us to take care of ourselves so we can take care of the other people in our districts.
Mm-hmm. Absolutely. Yeah.
And I think it's a community-wide need, right? It's definitely staff and teachers, but it's also, like we said, parents. It's everyone that can lead. It's community leaders, it's superintendents, it's principals, it's teachers. And it's also even remembering, our janitors and our lunch workers and all of those people, because they're all experiencing the same sort of stresses. It could be, it could be financial stresses, it could be health stresses, it could be just, hopelessness and mental health stresses. And so giving people, I love what you said, Tobin, about, moving those end of year activities to a time when you can give hope and have that hope be spread. One of the other initiatives we just, there's a former NBA basketball player named Jimmer Fredette. And Jimmer, his nonprofit is focused on something called Choose Kindness. And so it's helping schools change their entire culture to a school of kindness. And I think giving all of us that permission to be kind and that permission to be helpful. And the other thing is I think that when people have an opportunity to help, that that helps them as well. So that could be children, right? But compassion fatigue is a real thing, and it's very concerning to the education industry as a whole, that this overwhelming compassion fatigue that our leaders are feeling is is something that really hurts not only our children, but the education system as a whole. And so being able to provide supports and services to, whether it's the leaders or the children or the families or the community or the teachers, that's an important piece. And being willing to be vulnerable about it when you have those needs. And I think Paul Imhoff has done such a beautiful job of that, as well as others, of being able to say, it's okay not to be okay, and let us know how we can help you through that, whoever your communication stream is.
And I would say, as a society, we've lost a lot of grace. And education, we've obviously seen that with some of the different attacks on public education. And I just think people sit behind a keyboard or typing into their phone, and it's easy to attack somebody rather than to try and understand where they're coming from and why they're making a decision or why they have the opinion that they do. One thing that we talked a lot about, we do a lot of work with trauma-informed practices. Jim Spohr, leader from Walla Walla, Washington. We've had him on campus a couple different times. If you haven't watched the movie Paper Tigers, it's probably more relevant now than it ever has been. And one of the things we've talked about as a staff is everybody that went through the pandemic, we've all added one ACE. Whether it's our students because they missed that time from school, or the stress that went on, the families. And so just trying to get people to be a little bit more patient. And honestly, I think this is a place where our kids can be leaders on those type of things. And I mentioned Hope Squad earlier. Hope Squad is a peer-to-peer suicide prevention program, something we've really gotten involved with here at Lockwood. And that was kind of a response to a couple suicides that we'd had, and did some research on it. Connected with Dr. Hudnall, and his story was real similar to mine. I don't ever want to attend a funeral of another student again. And but one of the things I talk about with peers with Hope Squad all the time, if it prevents one suicide over 20 years, it's well worth any of the resources and time that we've put onto it. But what I've seen and what I believe happens with Hope Squad, and about a month ago, I went over and watched some of our middle school kids teach classes to other kids about bullying and those type of things. Is it really, it changes the culture of the school. It gets kids to think about empathy. How does that other person feel? How do they, how would I feel if I was in that situation where nobody was going to sit with me at lunch? And what steps can I take? And I think two ways. Kids are putting themselves in other kids' shoes, regardless of cliques, any of those type of things. And the other part of it is again, just having those conversations. Our Hope Squads, I had another school district reach out to me about how did they get a Hope Squad started, because they came here for a basketball tournament and they walked around our hallways and saw posters that were student-made posters about mental health and the negative effects of vaping and those type of things. And they wanted that in their school district. And so I think that process of moving towards trying to just get kids to develop empathy for each other and take that into adulthood is a positive for our society.
I love that. Empathy is really at the root of so much of it, because we're social beings and we work in communities and we learn in communities. And so having that empathy and compassion and the kindness and choosing kindness, it has to start there in so many different ways. And you look at but if you look at social media, there's an algorithm that's going to get you to the same people that think the same way as you do. And it's very easy to rile you up in a certain way, because
it's very easy to lose empathy.
Yeah.
And not truly understand the whole complexity. One of my mentors in graduate school always talked about, to be a good administrator, you don't have to see both sides of a situation. You have to be able to see it geometrically.
So true.
There's not just two flat sides. There's different angles And, parents are going to look at it differently than students, and teachers are going to look at it differently than trustees. And, you have to be able to understand all those different areas, and to be truly effective, the more of those different angles you can understand, the better you're going to be at your job. And I think that goes that way for all of us, whether it's politics or education or media,
Really everything. So for the students who are struggling, I actually probably we're going to talk a little bit more about social media in this next discussion. What do we do to help identify? You touched on it briefly earlier, especially when we're talking about teachers. You can only help as much as people share or that they let you into your life. When we're looking at the children, when we're looking at our schools and our communities as a whole, how do we best support and identify and ensure that our students are receiving the resources that they need?
So my opinion goes back to what we just talked about. It's really about relationships, and that's any education is going to be based off of relationships first and foremost. And so building relationships between staff members and students so that they feel comfortable coming forward, or that the families feel comfortable coming forward and saying, hey, we've got this situation. We don't know where to go from that. I do a weekly newsletter to our community, and there's several things, whether it's the newsletters from the Cook Center, just, hey, if you need any resources, come connect with us. We will help you out. We're here for you. We've kind of rebranded. We used to have a program, but we've kind of rebranded as our Family Support Center, and it's actually open in the evening. So if families, if a kid comes home and says something at dinner at 5:00, in the traditional model, that parent has no place to go other than lay awake, stressed out about it all the way till the next morning. And so what we do is we man that for a couple hours a night with our counselors and our community support specialist. And if the parents have an issue, they can call and reach out, and our counselors can say, hey, we've got resources for you. You're suddenly homeless. We can help you out. We've got the ability to get gas cards so you can get your kid to school. We've got connections with the shelters. We've got, places to get school supplies for free, and just try to take some of that burden off the parents. But again, that builds that relationship where they can learn more and more that, hey, the school's not adversarial with us. The school is here to support us. We're going to go forward with it and reach out. And also making sure that people know the pathways to go, just like we talked about with that multi-tier system of support. If a kid comes to a teacher and says, hey, or a kid comes to a teacher and says, this situation is going on, then that teacher can say, well, I need to reach out to my building counselor, or I need to reach out to our student services director, or so that they know the right pathway to go get those kids help. And word of mouth, the more we can help families, the better off we're going to be. And then it's going to smooth out for the next family.
Love that.
I probably just rambled on that section.
No, what you're doing is so, is so above and beyond what's happening in many schools. And so I appreciate your model and your leadership in that so much. And I think at the heart of what Tobin's talking about is really human connection. Really, it's about helping families connect with their children, families connect with schools, teachers connect with kids, staff and administrators connect with the parents. It's hard to be everything to everybody, but if we are a community of educated people who know where those supports are, then we are able to say it's like, and I was a teacher too. It's back in the day when I was a teacher, and it's been a long time. If a child came to me and said they were hungry, I was pulling out my own pocketbook and saying, let me help you. Or, I specifically remember a family coming to me asking for help with their Thanksgiving dinner. And so that's what I did. But communities like Tobin's have put systems in place to be helpful and to be able to support families, children, staff in different ways, and really understanding not just the human connection, but the human condition, so that everyone goes through ebbs and valleys or ebbs and flows in their life, and being there to help when they can. And even from a superintendent perspective, maybe even as a leader, sometimes you need that help. And there is, the Superintendent's Association that can help them when they're struggling with something, right? And so it's knowing what your systems are and knowing how to find that help, because I think it's Maya Angelou, I don't know, someone said it's very hard to hate close up. So we have a lot of discourse right now in our society that is putting schools at a difficult juncture. And the reality is, most people, if they get in and they see the amazing work that schools are doing year in and year out for their children, for their community, for our nation as a whole, they're going to realize that there are a lot of Tobins out there. There are a lot of leaders like this that really want to do what's best for families and for students.
I love that a lot, that you mentioned the systems, and it's having the systems in place and getting the resources out there. You don't know what you don't know. So if there's a family in a community that needs help, might need the gas card, doesn't even know that the gas card's out there for them, right? Like, so much of it is the communication, and you do that by developing the relationships, and you get closer to people that way. What would, kind of high level, a school district, a principal, superintendent, even a teacher or a parent who's listening to this and watching it, that feels like their community is lacking or has a lot of room for growth, as we all feel like there's room for growth in our own communities, what would you recommend as their starting point?
Can I take that to the start?
Well, let me go first, actually.
Okay. All right. I'll let you go first.
The first thing I would tell them to do is reach out to the Cook Center. Because there are grants and resources available through them. We've also done some work with the JED Foundation with our ASA mental health cohort. I know they're a little bit more East Coast, but there are resources out there. Just connect with them and get a hold of somebody like Anne and Michelle and Sandy on her team, and they're going to be able to lead you down the proper path. Now it's your turn, Anne.
Okay, well, you took a little bit of my answer, which is, if you are a school or a district leader, there is something called the AASA mental health cohort. And it's really taking a look at the nation of what are the exemplary places where work like Tobin's is going on. And it brings together those superintendents who are most concerned about the issues of mental health in our nation, as well as bringing the solutions to bear. So Tobin, again, he mentioned it as well, and he's been, one of the leaders and one of the speakers at many of our sessions. But if you are a school leader right now and you're watching this, that is available to you either through the Cook Center or the JED Foundation. Your tuition to that event can be paid for. So, come in and join with other leaders and superintendents that so that you can be part of the solution and understand the solutions that are out there, or share your solutions, because that's so much of what Tobin does, is he shares these wonderful things like having counselors there in the evening. And so that was my answer, but always Cook Center is here to help as well. So.
It's fantastic. It's great, developing your network and your community, hearing what other people are doing. That is where we learn from each other, for sure. I have one last question for both of you. I will let you pick who goes first. But May is Mental Health Awareness Month, and I'm sure both of you have a lot planned. But to set us up on the right, feel good, positive, there is good in this world, track forward, I'd love to hear a story from each of you. Just tell me a good story. Tell me about a success, or, something that helps you wake up and come to work every day. It can be honestly anything.
I'll go first. And I do want to mention one thing that we didn't get to in the interview before I go into this story. As a rural school and a rural school leader, a lot of times we think, that there's a lot of issues that go on in modern education that don't impact us in our rural schools a lot. It's an insulated community sometimes. But mental health is one that it truly impacts rural schools at a different level than most schools in the nation. Suicide rates in rural schools are always the highest. It's actually almost double in rural states as it is in urban states. The 3 states I've worked in, Montana, Wyoming, and Alaska, are always basically the top 3 for suicides in the nation. And we've talked about the stigma that goes along with that. I think that's something we can try to battle in those rural states. But the other one is the access to care, and things like we talked about earlier with the parent guidance program and the coaching is a way to maybe bridge that a little bit, especially for those families that are living, it's a 100-mile drive to the nearest therapist. And so I just wanted to mention that as we go. I'm going to go back a little bit to the Hope Squad, and we started the process of integrating the Hope Squad into our school district in November of 2019, and had Dr. Hudnall here on campus training our staff. And so we just kind of had started selecting our kids for Hope Squad at the end of the first semester, beginning of the second semester, and had done just a tad bit of training, some of the QPR training, those type of things. And statistically, they show that a student is usually going to ask for help before they take the action of attempting suicide. And 25 years ago, when I started as a principal, that might be saying something to their friend in the hallway that a teacher might overhear, or those type of things. Well, now that's probably going to happen on social media. It's going to happen on TikTok, or I'm sure the kids have probably moved on to something else beyond that at this point before I've been aware of it. But so one of the things that Hope Squad does is, obvious reasons, we don't want our staff being friends with kids on social media and those kind of things. But those other students will see that type of stuff. And so March 2020, we'd been in the process for just a few months of implementing Hope Squad, and basically we shut down. Everything was shut down. And during that time, while we were shut down, my counselors were getting emails from students that had been through the basic start of Hope Squad training saying, hey, my friend said this, I'm worried about them. Is there anything you guys can do? And so even in that remote setting, we were able to connect to the families. We were able to connect them with some resources, whether it was the mental health center, here locally, or those type of things. So that's my biggest takeaway. And that's when I became like, ride for the brand of Hope Squad, because I knew that it was working. Even with the very minimal training that we had at that point, it was having an impact on our kids and our community. The other thing that I would say, when you'd asked us about this prior, I don't feel like I'm the only one waving this flag anymore. I feel like we are gaining momentum. It's becoming a topic at more and more. I've presented where like one person was in the room and we were coming to talk about student mental health. And I'm like, I know other people have these issues. It's not just us. And, but now it seems like over the last 6 months or so, we've just really gained, and I know Ann had mentioned the ASA mental health cohort, but even at the local level in Montana, I think we've doubled or maybe even tripled the number of Hope Squads in our state this year, excuse me. And so I just think there's a real momentum on this, and people are seeing it as an integrated part of our education programs and another system of support, just like we have academically and behaviorally.
It's great.
Yeah, thanks, Tobin. I want to leave people with something that they can do, that they can actually accomplish. And it's a concept that was taught to me a couple of years ago. It's called mirror neurons. Have you guys ever heard of this? Yeah, Tobin has. The idea of mirror neurons is, if I was to yawn right now, you guys would both yawn, right? If I was to, your mind just automatically mirrors back what someone else is doing. And so joy and happiness can be mirrored back. Anger and frustration can be mirrored back. So people are really empowered to create a more joyous and kinder society just by how you interact with the rest of society. And, I've worked with difficult people before in my career. And when I learned this concept, what occurred to me is I tend to be a pretty joyous and happy person. And sometimes if I think about myself as the center of a circle, all the people who are kind of in my sphere tend to be pretty joyous and happy people because, now understanding that that's part of what I give out. So that's what I bring back. I've had people in my life who are kind of difficult, and I've thought, wow, sometimes I have to step into their sphere because they're sort of a difficult person, right? So maybe their circle's out here, and everybody who's in that circle is kind of difficult. But I have the ability to step out of that sphere and come back to my own and be empowered to continue that positivity in mine. So even if you encounter a difficult person, an angry person, public discord, any of those things, remember that you always have that power to create joy and happiness and kindness around you. And when you create that, you project that out through mirror neurons. And I would just encourage people to, understand that they are empowered to create the world that they want to have and that they want to be in.
I love that. That's really important for our leaders in our schools. And it's that idea of let your light shine. And, we all will come in contact, especially in schools, with disgruntled or upset or angry, or just people who are having really tough times, going through tough days, tough times. And it helps with the compassion fatigue too.
Mm-hmm. Yeah.
The joy and the kindness, and we help let it spread. That's great. I love that so much. It goes quick. We've hit the end of our conversation today, but Tobin and Ann, thank you so much for joining me today on Safer Ed. And thank you for everything both of you are doing in your ongoing contributions to student safety. And we look forward to further discussions. Stay safer. Thank you for joining us for this episode of Safer Ed. We hope that the stories you have heard leave you inspired to create safer schools in your own community. If you found the content of this program helpful, we encourage you to share it with your colleagues and friends. Safer Ed is available to view at edcircuit.com and on YouTube at edCircuit. Safer Ed is also available as a podcast on your favorite podcast platform. If you have thoughts on this episode or ideas for future topics, please join the discussion on Twitter at edCircuit and reference the hashtag SaferEd. Thank you for listening, and we invite you to join us for our next episode of Safer Ed. Until next time, stay safe and have some fun doing so. This episode has been brought to you by Science Safety. Science Safety provides a comprehensive and holistic approach to science safety risk management for schools. As a leader in science, STEAM, CTE, and lab safety, Science Safety focuses on helping organizations build a culture of continuous safety while improving lab and science classroom policies to reduce the risk of injuries and resulting lawsuits. Learn more at sciencesafety.com.